Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Turn on those notifications. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Herman. And with me, as always, actually next to me today on the couch is Sarah.
Hi.
Because today we have a very special guest, Dr. Sonya Reddy. Thank you so much for being with us today. We really appreciate it.
Glad to be here.
I know you're very busy, and honestly, thank you again for taking time out of your schedule to come and hang out with us. So today we are going to interview Dr. Sonya Reddy, and she's going to tell us about all the great things that she does. You're a cosmetic dentist, correct?
Yes.
And so, I just got to kind of ask you some of these just basic questions because I actually don't know it. I've had cosmetic dentistry, and I'll jump into why I had that. But okay, so is this something that you had always wanted to do, or are you I'm going to be a dentist, and you kind of got into the more cosmetic side, or how did that all kind of play out?
I think I enjoyed the functional side of it, which is a wellness side of the dentistry, which a lot of people do not realize. I come from a family of physicians.
Oh, really? Okay.
And it was all the, the wellness of it, right? It's not just the pretty teeth. It's about, hey, what's the overall health and function can do.
Absolutely.
And so now this whole uproar about gut health, and that's happened recently. But I think in general, just having good smile means so much for people, and just confidence. So I think when I got into it, that's a specialty I really wanted to get into.
Yeah. And
help them with smiles.
Yeah, and I think you're spot on too. A lot of people just think, oh, this is just purely aesthetics, but there is that health side to it. That's the thing that a lot of people don't know about. And I have to admit, although I know it exists, I don't know a lot. So I'm actually really excited for you to dive into that. So when you're going to do the cosmetic dentistry route, I assume, is that a fellowship after dental school, or how does that work? Okay.
So dental school doesn't give you in-depth analysis for anything, right? It just gives you foundations of everything. And then after that, students go out and learn so much about either cosmetic dentistry, dental implants, surgeries, or whatever you like. So it is an internship. You can go pretty extensive into it for years together. And there's many other talented dentists out there that are teaching these courses.
Yeah.
So you just have to dedicate yourself, and also you have to have the art and technical skills.
Sure.
To not just learn it, but be able to reproduce the results.
That is so crazy you mention that, because I think that the dentistry pathway from general dentistry to cosmetic dentistry is very, very similar to the pathway I took. I initially didn't want to be a plastic surgeon. I went into general surgery thinking I either wanted to do cardiac surgery or trauma surgery. And then I kind of fell in love with plastics due to the artistry, which I think is very similar to what you were talking about. It's not just the steps, right? You have to have that vision of creating something that doesn't exist right now.
Absolutely.
And it definitely sets at least my specialty apart from the general medicine specialties, and I assume it's very similar to that in dentistry.
Yes, we have a lot of parallels. Exactly. When a patient comes and they want pretty teeth, or they want some cosmetic stuff, we should be able to visualize before and after, right? And tell you. I say no a lot of times, and I think that comes with a lot of, okay, this is not for you. They want to extract all teeth and get pretty teeth, or they come up with these pictures of celebrities, right? I want big teeth, and you're blessed with small teeth. I'm sorry, I won't be able to give you all that, but here's what I can do.
Right.
I think saying no a lot, and also kind of reorganizing their thought process of what it's going to look like in the end, right? And kind of upfront and talk about that stuff, and then they're like, oh, this is a realistic picture of what I'm going to get, versus, oh yeah, sure, give me that filter and I can create that for you. It's usually really hard.
Yeah, I think that certainly, you're going to have the same things that I have in my practice, which is managing expectations, making sure patients aren't, trying to get something that can't be done, and then they're going to be disappointed on the back end. Yeah, there's definitely a fine line in that, and it sounds like I talk about this all the time when I'm talking about plastic surgery topics here. It's you have to make sure that what you're going to be able to accomplish is what the patient has in their mind. And I think, that's where a lot of people in our business fail. It is a skill, to be able to interpret what they're saying and say, yes, I can make that. And then you say that back to them. Because I think that's where a lot of people get in trouble is, someone will just come in and say, hey, I want this, and then the doctor does it, but it's not the same. What the doctor has in their mind and what the patient have in their mind is different.
So with this new technology in dentistry, there's so much of new technology where we can show before and after pictures.
Do you use the software?
Yes.
You do? Okay.
Yes. So I show them before and after, and they love it or they don't love it.
Yeah.
And then we go into intricacies, but at least in general, this is how it's going to look. And they love it because they're able to see it and visualize.
Yeah.
No matter how much you're going to tell them, hey, you're going to have this teeth, and they're like, I can't see that on me until I see it. I'm not going to know. So we do mock-ups as well, and show them like, hey, here's the mock-up of what it may look like.
It's interesting you mentioned that
broadly.
Because that is something in plastics they have, and I haven't embraced.
I was going to ask you that. Like,
so
do you have that?
It does exist. I used it in training, and I think at certain times it's helpful, and then other times it's not, because sometimes what's on the computer is not the end result either. And then I think, at least in my specialty, sometimes what ends up on the computer may not be what the end result is, but the end result is good. But then the patient's like, well, this is what I thought
you showed me.
Yeah, right. Yeah. So I like to not to go that. And the other thing I was going to kind of mention too is, it's funny you were talking about that you use that software, because I had cosmetic dentistry. I used to play ice hockey, and I got hit in the mouth. And at first it just kind of gave me some like little cracks, and I didn't do anything. And then I had 2 teeth break right in the front. And so I had to go and get, basically cosmetic dentistry to get it fixed. And I didn't know what to expect. I was like, is this going to look real? Because 2 of my front teeth are not real.
Right.
And I was like, is this going to look real or not real? And man, I was actually, well, first off, they didn't have the computer software.
Yeah.
So I kind of went into it just like, well, I hope this works out. But I was actually really happy. I think most people wouldn't think that 2 of my teeth are fake.
And that's the whole thing. People come to me and say, I want to get cosmetic dentistry. I want to have these like celebrity teeth.
Yeah.
They're white and all this stuff. But I'm worried they're not going to look, real.
Right.
And I assure them, that's
they're
the
gonna look
skill.
good.
Yeah, they're going to look good.
Yeah.
But you got to, again, it's like selection of the patient for us, and then for them to select. Like there's a dentist every corner, and there's a plastic surgeon, everywhere.
Yeah.
So why do they have to come to us? And I think that's part of like educating the patients. Like, hey, you come to me, this is what I do, and we have mock-ups of before and afters, with patient permissions, obviously. Show them what happened.
Oh yeah, we definitely have befores now. Yeah, I don't know, I've been on the fence about the software because people ask me about it all the time. And Sarah, I'm going to ask you, and I'm not putting Sarah on the spot. She's been very open about she has had some surgery in the past. Did they do the computer thing when you went there?
No.
No? Because you had it was like 10 years ago? I mean, it was in the time
I think it was more than that.
Oh, okay. Because I mean, they had computers back when I was in training in the mid-2000s.
Yeah, they had computers.
Well, I meant like the computer software.
Can they do that for like fillers and stuff?
Oh,
like
I'm sure
before?
they can. I'm sure they can. But man, having been in this business, because I've been now in plastic surgery since 2007. I've been in Dallas since 2010. And so I've been around for a while. I just worry about the same things with the software with fillers I'd worry about with surgery.
Yes.
It's like, okay, you throw the software in there, there's a picture, and then you get a result that's very, very good, but if it doesn't look like the picture, you will eventually get that patient that says, okay, this is good, but it's not what the picture shows.
Right.
And so that's why I've kind of been...
You think that just showing them previous, before and afters is so much better than just telling them, hey, you're going to look like this. And they're like, I want to look like Angelina Jolie. And now I look like Jennifer Aniston or something.
Right. Yeah. Yes, exactly that.
They're both beautiful, but...
I mean, we definitely use a lot of befores and afters in my business, but, I get a little nervous about having like a picture and saying, this is what you're going to look like.
Yeah.
I might say, you look very similar to this,
yes,
or this is the type of expectation or outcome I'm expecting for you.
Right.
But I would have a little bit of fear, and especially because that's part of a medical record, right?
Yeah.
Your computer pictures. Yeah. So just for me, I'm a little about that. But
do you know any plastic surgeons using those?
Oh, yeah, absolutely, they do. Yeah, and they'll tout them. Plastic. I'm sure cosmetic dentistry is the same way. Plastic surgery has become a marketing arms race. Yeah. I mean, especially in the Metroplex, it is insane the stuff that you see out there. I mean, I could do an hour segment on that alone. But I wanted to ask you, I know I looked at your socials, and you're very involved with social media, which obviously with me is the same thing. And this is how this whole show came about, was getting on social media. I actually started live streaming on TikTok during the pandemic, and that was kind of the origin of the show. But how did you was that like a necessity for you being a cosmetic dentist to get into social media and just took off, or how did that come about?
I think, it was accidental and also, intentional. The accidental part was like, I didn't imagine it's going to be so big after, you know, a couple of years. And the intentional part was, I want to share my cases, you know.
Yeah.
Some of them had great outcomes, and they came with happy stories. It's not just a smile, right?
Right.
Mom that could not smile for her 16th, you know, for her daughter's 16th birthday, we're able to give her that smile within 2 weeks.
Oh man, social media eats that up.
You know, yeah. So I wanted to show those,
Yeah.
and because a lot of people would come to me and be like, oh, I can't get that done because I heard you're going to make it look like chiclets, you know, they're going to be fake teeth, and I'm going to have fake teeth the rest of my life. So I think that I just started just to kind of enlighten people, so it can be done in 2 weeks. There's different, you know, technologies like we're talking about. And then I just fell into it where, you know, I created the community, people were asking questions, and I think I was able to break the whole clinical curtain out, and now I became more personable. I love that
about social media,
right?
Yeah,
And they were like asking me questions directly. My team was answering them, so it became really exciting and interesting part of it. And then, you know, taking videos in between of the patients. Patients felt really like part of a community, part of that, you know.
Right.
So
I think that your experience and mine share very similar correlations in that, you know, I basically got on social media because I think the expectation was if you're a plastic surgeon, you have to be.
Yeah.
And then I started doing these live streams whenever TikTok became a thing. And you know, there were times where I'd have thousands of people watching this live stream, and they were just asking questions. And it broke down that barrier of, oh, a doctor's impossible to get a hold of. Like, here's a doctor live streaming, and literally I can ask him a question and he'll answer it live. And I was like, wow, this is pretty powerful. And so, of course, that morphed into this, which is, you know, continue to get bigger and bigger.
Right? We're able to talk about this.
Yeah, you're gonna have to get your own show here pretty soon.
It's gonna happen.
and tell me about one of the things I love about you, and I know we just met, but of course, you know, I was, you know, learning about you.
Snooping.
Snooping, right? You got to do your research, right? You got to do your research. I love that you have kind of branched off into these other, I call them side gigs, but business endeavors being the proper word.
Yeah.
I read that you had co-authored a book and you're into coaching now. Can you tell us a little about those things that you've got into?
Yes, I think the whole community kind of, you know, that we created became so big, and, you know, doctors started asking me questions. How do you manage it all? I had 2 practices at one time. I'm a mom, and they were like, you look great and you're on social media. How are you doing this on point when I'm, you know, because burnout is crazy in our profession.
Sure.
So much burnout because we're handling everything. And I always talked about, you know, how we're lonely on the top because you're the CEO, you become like, you know, everyone comes to you for questions. And so I think I just started coaching them as to what worked for me. And, you know, now I became a coach.
So it's like a life coach for specific, like for doctors specifically, or just
doctors and executives. You know, it could be, you know, it could be like executive, like it could be women that are like juggling with stuff and nobody to talk to. And I'm also now morphing into executives. It could be like, you know, in a corporation, whatnot. Yeah, I love it. Just the whole best thing about, you know, dentistry that I got into is like in the connections, right? Human connections. We're able to do that with the patients. Now I'm able to do it with other people that are like me, similar to me. And I think I just don't feel the competition, right? I don't feel like, oh, you're competing. You're just on your own. You do best for you, and then I do best for me. So I love this whole like networking thing that we created.
Of course, the networking's huge.
Yeah,
I mean,
it's like now I'm able to talk to you. Like I have a network of doctors. Like with ENT, I have network with, because this whole wellness practice, right? It involves every doctor.
Sure.
I can't solve all the problems. Sometimes I go in and I notice that there's an ENT problem that I need to refer patients to, and I want someone like you that I can pick up a phone and say, Doc, handle this patient for me.
Yeah.
Do you ever like see cardiac issues? Because I know healthy smiles can not interfere, but it's like a symptom of cardiovascular disease. Do you see that a lot?
Yes, the whole sleep apnea thing I got into is, you know, when you have less, you know, oxygen to your heart works harder and harder. So then leading to other, you know, cardiac problems and obstructions. So my dad was hospitalized with a cardiac problem exacerbated by sleep apnea.
Wow.
That's how I got into this whole sleep apnea. It can do all of this stuff. It also can cause Alzheimer's and dementia. And that's when I started networking with, you know, more professionals like you. Because I want to discuss with you guys, like
It is interesting. Plastic surgery does intertwine with sleep apnea, and I remember that when I was in training. Now, I will say that in my personal practice, because as you may or may not know, plastic surgery is extremely broad.
Yeah.
And so, people focus in different things, and I have a couple of or 3 areas that I really focus in, but the one area that mostly deals with sleep apnea from a plastic surgery side would be craniofacial.
Yeah.
Because you're talking about altering the palate, you're talking about altering the jaw, the uvula, the soft tissue, pharyngeal tissues of the mouth, and so theoretically, could I do those surgeries? I mean, sure, I had the training many years ago, but
Right.
in practice, am I doing that? No. So, but yeah, I'm eager to learn about, because I think that you're going to give us some more information about the sleep apnea.
The whole thing you just talked about, how pretty faces, I think, are functional faces that are working well, which is everybody wants like a chiseled jaw.
Yeah.
But the jaw is forward at that point, opening up your airway.
Yes.
And
I think I told you I have sleep apnea because my one thing that I have is like I don't have like a very protuberant jaw.
Yeah.
And I know that because of that, like it obstructs my airways when I sleep. My wife, I didn't even know I had sleep apnea. My wife had to tell me because it wasn't bad enough, I guess, that
It's gotten
would you
worse as you've gotten
snore, or
older.
would you grind your teeth, or snore, or what?
snore
Okay.
and like stop breathing kind of thing.
Yes.
Yeah.
Oh my gosh.
And I had no
yes.
idea
it's
because
scary for people that hear you.
like, did my
It's like,
husband
is he
just die?
stopping to breathe?
Is he dead?
Yes.
And so, I didn't even know it. And so far, to be honest, I haven't done a whole lot about it. The one thing that helps me, I do use those breathe right strips, which that opens up my airway enough, because I think my sleep apnea is pretty mild.
Right.
Like just opening up my airways is enough that I don't have it.
Yeah. The smaller palates are causing narrow airways, right? Like if we can, in orthodontics, the craniofacial surgeries that we're doing is we would put like small tiny implants in the palate.
Yes.
Split them open,
I read
put the
about that.
implants, and then let it kind of.
So you guys are doing that as well?
Yes.
Okay, and is that an OMFS, or is that more cosmetic dentistry side, or?
It's not cosmetic. It's more. It's another specialty for with implants.
Okay.
You put mini implants. You actually
see.
split the palate, open it up.
Wow.
Because people that have small palates.
Sure.
So the whole part is like when you breathe, your tongue is on the roof of the mouth, and so if there's not enough space, your tongue doesn't go all the way, so you're not able to breathe and swallow properly. And then people are becoming mouth breathers. So the whole thing is like, how do we make them nasal breathers? But by expanding the palate, which is a floor of the nose,
Sure.
you get more.
Space.
Air. Yeah, exactly.
Interesting. Yeah, I haven't gone down the road of like seeking out medical treatment for this yet, but I mean, it may come to that. I think the one thing that helps me is I stay relatively thin. I think if I gained weight, then I think this problem would become a lot worse. Yeah.
Absolutely.
So I
The
have
second chin too, like people that
Yeah.
are like, thin are having this because of the jaw being pushed back, right? If you push the jaw forward, you won't have the second chin.
And so I guess for people out there that might be watching this, like, what would you tell them if they thought that they suffer sleep apnea? Like I guess I could probably say, but I'm sure you can do it much, much better than I can. Talk about what should people look for? Like, is there certain signs?
I think mouth breathing. In kids also, kids can also suffer with sleep apnea. I think people don't understand that, and it causes behavioral issues in kids. It's not like the adults have snoring, lack of focus, brain fog, but for kids, it becomes more like a behavioral ADHD-like symptom.
Really?
So if there is an ADHD kind of kid that's not able to focus, I would first look at his breathing, the way he breathes. I mean, watch him at night. It's creepy as it sounds, like watch your kid at night, see if he's, having struggle breathing, or is he grinding, is he opening his mouth. So mouth breathing causes excessive air to go in and causes, inflammation in the adenoids and tonsils and all that stuff.
Which is, I think that's really interesting, because I would suspect that a lot of times when a kid shows symptoms of this, like either the parents or their doctor's first inclination is, well, we need to put them on medication.
Yeah.
Yes.
Which I'm kind of against that. I mean, obviously there are people out there
We're like a medication-heavy society,
Yes.
right? It's
Yeah,
like
I mean,
everything there's a medicine. But if we really look at the root cause of why is a kid having focus issues, is it really brain issue? Then it could be needing medication. There's some things you cannot avoid. But if it is related to sleep, poor sleep and mouth breathing and all
That's
that
very
stuff, they
interesting.
look tired all day. I can share some pictures we can show so they know how the kid looks like. They look. And the mid face is underdeveloped majority of the times.
Sure. Wow. That's something I hadn't really. I mean, you always hear, because I've I've researched sleep apnea for different segments, and it's like, yeah, it can affect, it always says mental health, but it doesn't dive into it.
Sarah doesn't have sleep apnea. See, pretty face. Pretty faces.
You snore, Sarah?
I don't think so. Cody says that I've snored before.
Really?
But I think maybe because I had like my nose was
allergies
clogged
or something can
Yeah.
do that.
Yeah.
Yeah, I think that I do snore, and I think I figured it out. I mean, it's just perfect. It's just due to like jaw shape and the fact that I have more of a retrognathia.
My dad definitely had it, but he was overweight, had cardiovascular disease, and one of my sisters also snores a lot, which she probably what has happened.
Oh, sorry, we just had something up on the screen. Yeah.
Anyways, and my family has suffered from just being overweight and the snoring. Like I remember my grandfather would just fall asleep on the couch and just like snoring so loudly.
Sarah,
my
you
uncles,
won't
all
believe
of
this,
them.
but every patient that has like come to my office, and even if they're like I told you, like, oh, her face looks good, it doesn't look like she has sleep apnea, but everyone knows someone that has sleep apnea.
Yeah.
Your
But
wife would be like, I
people
know.
don't even try to figure out if they have it. They're just like, oh, I snore.
I snore, and that's how it was. Like it became a joke in my family because my dad snored so loud, like we could hear downstairs.
Wow.
So for years we were like, "Oh, Dad snore, like he's
Yeah.
sleeping," and Mom sleeps through this.
Wow.
And then when he was hospitalized, that's when we found out that sleep apnea exacerbated that because his heart was working so hard for so many years.
Sure.
And there's so many behavioral health implications with sleep apnea, just not the heart. Brain, kidney, everything. You put a lot of stress on the body, causing more inflammation.
Yeah. And and I think that a lot of things, one of the things people don't realize is this is a cumulative effect. Yes, one night of snoring is not going to kill you, but I mean, we sleep every single day. And then over the years, it starts to add up to things like...
Well, sleep is just so important anyways.
Yeah, absolutely.
Yeah, and now I think people are more talking about the sleep, right? Like before, it's like, oh, the less you slept and the more power person you are, There was articles on like, oh, 3 hours sleep and I can like function. And now I think it's like gone reverse.
Yeah,
like,
I think Joe Rogan is really big on that. He's like, I sleep 4 hours a day.
I have to say, like, I'm an insomniac. Like,
I would go with
sleep 10
if I could. I would go with 10 hours if I could.
Really? Yeah. Like, I really am an insomniac. I have trouble sleeping, and so I've had it my whole life, which actually has worked out great being a surgeon because like
if kids don't wake us up, it'll be great, right?
Right.
Yeah, I can wake up with like that. If I hear a noise, I'm like, hello.
I know.
Wow.
I think it's a mom brain.
Yeah.
Apparently, after we become moms, we only sleep like 20% of the
It's like
quality.
a survival technique.
Because they say like dads sleep fine. It's just like moms with like a small like noise and then you're awake. So.
Yeah, very, very interesting stuff. So if people wanted to find you to, I guess, are you treating sleep apnea patients at a practice somewhere, or are you more?
Yeah, right now I'm a little travel sabbatical.
Oh, wow, great.
But I will be back treating patients. But in the meantime, if they have any questions or whatnot, I'm on social media, Dr. Sonya Reddy, Sonya Reddy.
I think we have that, Trey. Can you throw up our social? Do we have that plugged into the computer there? Or we can throw it up at the end, maybe. Yeah.
That's me.
Oh, that's Sarah.
I can't talk to you about sleep apnea.
Don't ask Sarah about sleep apnea. There we go.
I'll send you a link to Dr. Reddy.
Dr. Reddy, yeah. Excellent. And then the last thing I wanted to ask you about, it said you co-wrote a book. Is that was more about the coaching, or?
No, this was years ago, but I'm writing a book about coaching and how, because I told you I got so many questions about how it is to be a CEO and run it all. Yeah. And I have some hacks and all, wellness.
Wow.
Moms are so like women in general are so interested. Whenever I had my boutique, my storefront, constantly getting DMs from women saying like, how are you a single mom and are doing this?
I feel for you guys, the single
mom
parents.
here too.
Yeah, it's difficult, but sometimes I think with you too, just any person, it's like if you are given cards, you just have to play them. And there's no other way.
There's no point being a victim-minded. You just have to.
You just got to push forward.
Rock it.
Yep.
Awesome. All right. Well, I really appreciate you informing us about all those topics, and I hope if anyone has any questions about it, they'll leave us a comment and reach out to you on social media to learn more. So.